Great. Well, I just want to first start by thanking you all for coming and thanking Perform for inviting me to give this talk. I've sort of used this talk as an opportunity for myself to sit and reflect on where I am at as a relatively new researcher on aging and where I can be most useful in my research moving forward in these pandemic and hopefully one day post-pandemic times. And so I've been really sitting with three things. The first thing is, feelings of grief and anger about the rights abuses that have occurred in long-term care homes in the city, in the province, and in this country. I've also been sitting with a recognition of the heightened fear and anxiety senior citizens are facing right now as they go through their everyday lives in this pandemic context, and especially with this second wave. Public health authorities in Montreal this week have raised concerns about the increasing cases of COVID-19 for those age 65 plus living in certain neighborhoods in the city. So there's an additional layer of precariousness to everyday life for senior citizens right now. And this is especially true for those most vulnerable, who might be living in intergenerational households, perhaps with children who are essential workers in the healthcare and food sector, for instance, who are perhaps taking care of their grandkids, right? So there's a lot of extra precarity that's happening right now. I'm also, number three, sitting with a recognition of the social isolation that can come from the loss of activities in neighborhoods that brought essential human contact for senior citizens, while also recognizing that there have been incredible stories of collective community capacity building and support during this time. I mean, I'm just thinking, for example, of the work at Concordia that the ACT team has been doing, working with organizations in the NDG borough to develop flyers for folks that kind of provide a list of resources for activities. They've also engaged in a new meal delivery service program. So there's all kinds of examples like that happening. We've also seen a lot of innovations in online programming. For instance, our Art Hive programming here at Concordia has been doing a lot of that for senior citizens. I'm also concerned, though, that when we live in a society that relies so much on volunteers, neighbors, community organizations, we may have situations where some folks are falling through the cracks because they just don't live in that place where those organizations exist. I also worry that not all seniors have access to online programming and services because internet and computers are costly and not always accessible. So I believe that the pandemic has created what we call in political science and policy studies a policy window to address systemic forms of ageism in our society that are at the root of a lot of underinvestment in key supports and services for senior citizens and all their diversity. So key questions I'm asking myself here is, what is the role of researchers in working to create a world in which all of us feel safe and cared for as we age in our communities of choice? What's my own role as a scholar in urban policy and politics? And what is a research agenda and what is my role in it? So my own research to date has been focused on aging in place as a policy goal that's favored both by governments and by many senior citizens alike. And sort of in a nutshell, aging in place is a goal of having folks age in their pre-existing geographies. So this includes perhaps in their longstanding residence, in their familiar neighborhood, surrounded by their community, their friends, in their city. A popular solution to achieve this goal of aging in place is this age-friendly cities and communities policy program. It's also known as Municipalité Amie des Aînés here in Quebec, or the MADA program. And this is really an agenda that recognizes that cities of all sizes have not been designed to meet the needs of senior citizens and all their diversity. And there's also recognition that cities need to meet their needs as defined by seniors themselves in realms of housing, transit, health supports, social and community services in neighborhoods, and planning infrastructure, for instance. I believe that taking a place-based lens to the development of policy on aging is very important. And I think a place-based lens is important because it allows us to begin at the grassroots, begin with the diverse experiences of senior citizens in accessing or not accessing the supports and services that they need in their communities to survive and thrive. A place-based lens or agenda also allows us to identify the diverse governmental actors who are responsible for regulating, funding, and managing these services and supports. I tell my students, the state is kind of everywhere and we need to understand that. Building codes, roads, streets, it's everywhere. A place-based lens also allows us to identify and understand the role of non-governmental actors in providing supports and services for seniors. So we can think of biological and chosen family, neighbors and volunteers, NGOs, businesses, universities, right? Some of these folks are contracted by government to provide supports and services for seniors. Some are replacing government in certain areas. There are partnerships happening. So a place-based lens allows us to kind of understand that. I think in theory, this Age-Friendly Cities and Communities program that I study can be a really helpful way of coordinating all of that, of aligning, of researching, understanding, coordinating, and aligning to ensure that nobody is falling through the cracks. Unfortunately, there are some systemic problems with the ways in which aging in place as a policy goal and age-friendly cities as a policy solution have operated in practice. And we've seen some of these problems really become more and more visible with the pandemic. I have a book coming out later this year with McGill Queen's University Press entitled The Right to an Age-Friendly City, Redistribution, Recognition, and Senior Citizen Rights in Urban Spaces that offers a much more fulsome analysis of this. But I want to talk about, I think, 3 major issues today with some of the problems we're seeing with these programs and how the pandemic is really illustrating this. I think number 1, there is this tendency to see aging in place as distinct from aging in a long-term care setting, and even perhaps as a rationale for moving public money out of long-term care. As we've seen from this pandemic, we need long-term care to be properly invested in and regulated. And this includes caring for care workers that are working in these places. We need stable employment, good wages, safety protocols, and equipment so they're not putting themselves and their families at risk. I think we also need to understand that long-term care is located in place. It's not out there, it's actually in places. and as such, it's affected by staff and visitors moving in and out. We need, and we've always needed, crisis-oriented safety protocols to recognize this. I think when we begin to recognize that long-term care is in places, we also begin to recognize that neighborhoods need long-term care. It actually allows, if one needs long-term care, it's a good thing to have it available in one's neighborhood rather than having to go out into the suburbs to live after one is familiar with their community. I think if we think about how to integrate long-term care into this age-friendly program, we can really begin to think about innovations to long-term care, how to bring intergenerational programs in, how to maybe bring community gardening and art programs in, and how to think about the right kinds of sanitary and safety protocols for this kind of integration. So that's the first issue. The second issue with these policy programs is there's a tendency to see age-friendly cities and communities as highly localized strategies. So either only strategies of municipal government or very small kind of project-based strategies that are undertaken by NGOs. Now, municipalities and NGOs are crucial actors in supporting seniors, but I do worry that this hyper-localized approach can kind of absolve central governments from really taking a good look and thinking at their own policies and how those affect the everyday lives of senior citizens in local places. Provinces and feds have huge roles to play in the area of income support, housing, healthcare, public transit. I think we need a research agenda that looks at what a truly intergovernmental, age-friendly city and community can look like to really scale up and to actually achieve this policy goal of aging in place. The third issue I want to talk about is that there's a tendency to see senior citizens as a homogeneous group in these policies, and especially as a privileged group. And as we've seen with the pandemic, this is not the reality. Aging intersects with various structures of oppression, and that means that aging in place is much less safe for some seniors, and this can be ignored in some age-friendly city policy. The voices, experiences, and needs of those seniors are not always taken into account in policy development. There also seems to be, in some cases, a lack of a systemic kind of cohesive strategy or relationship between all of the different NGOs existing in communities and providing supports for those vulnerable seniors and cities. They're not talking to each other, and programs aren't always coordinated. This becomes a risk with age-friendly city policy because we start to see age-friendly city policy as sort of like, oh, it's a nice add-on. You know, it's a nice add-on, but a lot of these programs are vital community programs that need to be expanded and maintained in crisis contexts. I'm just thinking, for example, of vital library programs and services that offer internet access for folks that may have shut down. I'm also thinking about meal delivery supports, friendly visits and check-ins that I think municipalities need to get a handle on. A lot of this is being done informally by friends, neighbors, volunteers, and I think there's a lot of folks that are falling through the cracks on that. I think there's a lack of governance. So what I think we need in terms of a research agenda here is really mapping out who is supporting seniors in communities, how, where, who isn't being reached, and in what neighborhoods. Where are the gaps? Who in government is responsible and should be responsible and accountable? What actors do we need to get together to start talking to each other? And how can this inform policy now and after the pandemic? So I've highlighted several things I think we need to focus research on and that I intend to do. I'm currently participating in a couple of research projects that were ongoing before the pandemic and that have had to adapt and that will continue having to adapt over however long this lasts. So I'm working with a team of researchers at Université de Montréal and some seniors organizations in the borough of Montréal Nord to develop an indicator tool that can assess the age friendliness of a neighborhood, kind of like a walk score. And this can be used to map availabilities and responsibilities for different services and supports, and also highlight where there are gaps. This could be used by senior citizens, organizations, and even governments to begin to map out what's there and what's not. It's been a very big challenge continuing with this research because we were doing surveys with senior citizens to ask them what the crucial elements are of an age-friendly city. Especially difficult right now to access those that are most vulnerable and to get their insight. And it's also not very easy right now to talk to different NGOs and government actors because they're so busy providing emergency support. The project is ongoing, though. I'm also part of the Living Lab Mall project in the municipality of Côte-Saint-Luc that's led by Janice Timbodos and several other researchers that are affiliated both with Perform and with Engage, which is Concordia's research center on aging. This project started off in an effort to build a community space with art and media for local seniors in a dying mall, a mall where a lot of stores are closing. This project has been moved online in the context of the pandemic in a really beautiful and amazing way. I think for me, I've always been interested in understanding the ways in which seniors can turn spaces into common venues. And I'm interested in how governments and universities can support this. I think what this project is showing, and I think what's interesting about the element of it being a dying mall, is that this is going to be a continued issue post-pandemic. I think we're going to need to think about how to creatively reuse urban venues such as office buildings and retail spaces. And I think it's important for senior citizens, community organizations, and governments to think about how to do this, how to design the types of toolkits to do that. I've also been spending a lot of time over the summer working with researchers on aging to develop projects that are focused on how government can better support some of the most vulnerable senior citizens, such as those facing eviction, experiencing homelessness, those who are relatively new to the country, and those that are living with dementia, among others. These are folks that have often fallen through the cracks in aging in place policy and age-friendly city policy. These folks often rely on a variety of government and NGO supports that are often not talking to each other. This has been made much more complex with the pandemic, we think, and we need to study this. So we're really thinking with these projects about how do we bring the experiences of these seniors and their NGO practitioners into policy toolkits that can inform government policy, and particularly aging in place and age-friendly city policy. So in conclusion, like I said, there is a big policy window here with the pandemic. I think researchers need to work together in interdisciplinary research teams with NGOs, with senior citizens and their caregivers to really research and push for changes in aging policy so that no one falls through the cracks in the way that the pandemic has made visible, but that also pre-existed the pandemic. I see my role as a political science scholar in really thinking about how to bring that policy lens in deciphering complex responsibilities and accountabilities, and helping to work to develop policy tools and advocacy strategies that can be rooted in the everyday needs of senior citizens in all of their diversity. So thanks so much for listening to my presentation or my talk.
Thank you very much, Megan. It was a very interesting talk, different than what I'm usually used to, because usually we had, you know, the PowerPoint and things. Yep. So it was a nice change. It was a great start. I don't see any questions for you in the question and answer so far, but I do have questions for you myself.
Sure.
I'm just wondering, what in your age-friendly cities project, what do you find is different between, like, have you found differences between those seniors that are living in suburban areas where things are less accessible compared to seniors that are living in the city where you have, you know, metros and subways and public transportation? So I'm just wondering, what have you found there in terms, like, what are the differences?
Yeah, I mean, there's certainly a lot of everyday differences in terms of, I mean, I think a big thing that I was bringing up in the presentation is just the variety of kind of community organizations and nonprofits and how important kind of they have been and are in providing transit, in doing friendly check-ins and visits, and really kind of accessing people and asking what those needs are. And I think something that we really do need to explore is the way in which those do exist in inner cities, and maybe not in every neighborhood. And I think that's a problem, but may not exist sort of in the suburbs. And so I think there's a lot of concern. And I recall this in my interviews with city staff as well in the Toronto context, that there's a really big concern around social isolation, in particular for seniors in suburban areas. And my guess, and I think this really needs to be explored, is how the pandemic is affecting that, and what that has to do with, like, the variety of organizations that exist in those spaces that are kind of checking in and supporting folks.
Mm-hmm. So I have a question from an anonymous attendee, and she says, it's important to integrate seniors who experience a sensorial loss, vision or hearing. They often have difficulty integrating into activities for the general public. Do you want to comment on that?
Yeah, no, I mean, absolutely. And I think that's exactly the kind of thing that I was trying to get at and mention when we think about how some of these policies, they take a really kind of homogeneous perspective and are not always looking at the various different types of lived experiences given our bodies, given the way our bodies shape and change, given structures of oppression and where we're at on these things. And I think this is a really, really big issue in thinking about, even when we have to inform this age-friendly cities policy program, there was a lot of public consultation, right? Well, are we thinking about how to do public consultation sort of properly, and thinking that we're using, PowerPoints or what kinds of tools that we're using, the languages it's provided in, right? And we really need, and I think that's where there's a lot of opportunity for cities and folks that are doing these kinds of things to work with researchers, right? To work with NGOs, to work with senior citizens that are kind of experts in their own lives and their own kind of challenges in this regard, right? To ensure that everything is as accessible as possible.
Okay, I thank you for your answer there. I do have a question that's actually related to the next question. I'm just wondering, what have you been doing with regards to moving your Living Mall program to online and the internet? Are you, what have you been finding with that, and how have you been addressing any issues that come up?
Yeah, I mean, so this for me, I haven't been so direct in moving a lot of those services and supports online. That would be the researchers that are, Janice Timbodos with Art Hives, for instance, they've moved a lot, and all the students have really moved a lot of that programming online, which I think is wonderful, and it's been extremely popular, and that's great. I think my own interest as a political scientist, kind of coming at this, is sort of in what ways are we thinking about folks that maybe can't access internet, or how are we sort of advertising these types of programs and that they're available, right? And I think that's always that, for this research team, this is an issue, but for all of us, it's an issue, is how do we reach out to folks, right? And I think here I'm really interested in the relationship between these kinds of university partnerships that are so great and that are delivering these types of services, and municipal government, and in the roles that they have in really ensuring that everybody has access to these kinds of programs. And I think that for me is that sort of a linking piece.
Okay, that sounds, thank you. We have another question that says, how do I get involved in the program online now? Oh, I think Wendy's going to answer that
okay.
for you. Okay. Another individual has has put up a question that says, have you begun to notice any differences between your CSL and Northern Montreal communities?
In terms of sort of what projects? I mean,
I'm not sure. That's
okay.
all. That's the question. Sorry.
Yeah, I mean, no, it's okay. I mean, I think it's a big, I think what really interests me in a research project that I'm moving forward is really looking at the role of boroughs, frankly, and how boroughs kind of offer this really interesting kind of local form of governance potentially, right? So we look at Montreal and we have borough systems, which like the city of Toronto, where I've done most of my research, doesn't have. So it doesn't have that sort of local form of governance that can actually potentially get to know its community in a really a more intricate way, right? And actually help like design the kinds of services and programs and community centers and libraries that are a little bit more tailored to that community. Like in Toronto, we have this major mega city. So that's a problem in actually getting at diversity. And I think something that really interests me is like, what is the role of boroughs in actually facilitating the kind of diversity that I've been talking about here, right?
Yeah, actually, with regards to the diversity thing, the next question is actually, how are visible minorities coping during these times? Are they actually being affected more?
Yeah, and I think that that's certainly something that we've seen, and that's something that that we've seen in geographically in different neighborhoods in Montreal, for instance, in Montréal, right, where we do have large populations of racialized communities, where and that can intersect certainly with poverty. That can also intersect with issues around kind of like where are services being offered in different languages, where folks know how to kind of access testing, because these are the types of services that were perhaps once offered in libraries in communities that have sort of been shuttered, right? So I think that's a whole other issue that we need to explore and understand. So I think there's all kinds of issues there that we really do need to wrap our heads around. And that's something that certainly this research in Montréal is going to continue to explore for sure.
Okay, that's great. Thank you so very much for such eloquent answers.
Thanks so much
Thank
for
you
your
very much,
questions.
Dr. Joy.
Thanks.